Okay, I am trying to, as promised, record a lecture for you guys, but my Loom subscription got all foobarred, so I'm trying to record this in PowerPoint for y'all. So, as requested, we are going to discuss uroliths and urinary crystals, and I'm going to post this, hopefully, if this all works, in an Edpuzzle quiz for you guys for some out-of-class type points. So, starting off, uroliths and urinary crystals. These are all mineral-based, but there's about 10 different minerals that can compose any of these urinary crystals. 2 to 10% of these have an organic matrix. And a lot of times when I say matrix and I think of matrix in terms of urinary crystals, what that means is basically there is a nidus, or a little spot, there's how my hand is, little spot of goo that the urine starts, because of pH and chemical composition, starts depositing crystals upon crystals upon crystals around. So you end up getting this kind of hard substrate to them. Crystals and stones can happen literally anywhere in the urinary tract. Clinically, we see them most commonly in the bladder because that is when they are most likely to cause clinical signs. Why do they form? It could be because of that matrix. So animals that have frequent UTIs certainly are at higher risk of developing urinary crystals or stones. There are what are called crystallization inhibitors in urine, and those themselves can get inhibited. But really, the precipitation or the formation of those crystals in solute and different chemical factors can affect how fast, quickly, or if these types of crystals occur. So, all uroliths, so all stones, start as crystals. And for whatever reason, and often there's multiple reasons, you get a large number of crystals in the urinary tract, and those form, and then all of a sudden you get slow transit, meaning we're not peeing them out very well through the exit. So factors that can precipitate crystal formation are UTI, different forms of diet, so cheap diet, or non-optimized diet. So like when we talk about cats with FLUTD and the need for them to eat CD multicare or something similar for the rest of their life, diet does play a role. Intestinal absorption of minerals sometimes can precipitate or predispose animals to developing crystals, as well as just their overall urine volume or frequency of urination. So a lot of these crystals form in really concentrated urine. So animals that are PUPD or have appropriate adequate water and fluid intake and urination output are at less risk. Some therapeutic agents can cause crystals. We'll talk about one a little bit later. And then genetics just play a big role. You guys all know we see schnauzers with crystals. Dalmatians get uric acid crystals. So genetics do play a role. The microscopic crystals by themselves rarely cause serious issues in dogs. Now, cats are a different story, right? Because their urethra is teeny, 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 tiny. And so they tend to form plugs. So macroscopic uroliths in the lower urinary tract that interfere with the flow of urine and irritate the mucosal surface. So if you get a ton of bigger crystals in that bladder, then the bladder wall itself starts getting angry and irritated, and that's when you start seeing animals that have much more visible signs of UTI. They're peeing frequently, small puddles, maybe having accidents in the house, or they're straining to urinate. But a lot of times, these crystals in urine are asymptomatic unless these guys develop an obstruction, or if we have the concurrent development of pyelonephritis, which is inflammation in the renal pelvis and kidney itself, or infection in the renal pelvis and kidney itself. How do we diagnose them? If you have an animal that's got a big, huge bladder full of stones, and these are most commonly going to be dogs, sometimes you can actually palpate them. And I'm like, oh, good grief, how did you live like this, kid? And it feels like a bag of rocks, essentially. Sometimes we can feel a very firm or turgid urinary bladder if they are obstructed. And sometimes you can even, if you go in rectally, that urethra traces right down below the rectum. So sometimes, especially like in female dogs or male dogs, if they're obstructed, sometimes you can actually palpate that stone and where it is in the urethra itself. X-rays are an important tool when it comes to actual stone formation. X-rays don't usually show us the crystals unless there's giant volumes of them. And sometimes there are, particularly in our blocked cats, but stones are often very easily detected on X-ray if they are large enough and if they are the appropriate type, because not all types of stones are in fact radio opaque. So some urate stones and some cystine stones are not radio opaque, so they won't show up on an X-ray. Yeah, here is just a couple pictures, and unfortunately my head, and I don't know how to move the camera yet, is blocking. Let me see if I can turn the preview off. There we go, cool. So some stones will show up very, very easily down in that lower corner. That dog has multiple stones. In the top image, there's just one giant stone in there. And you can see on the left-hand side here, those are just some different varieties of stones, what they look like grossly once they are removed from the bladder. All right, let's talk about male dogs. Male dogs are by far and away more likely to become obstructed, and this is an anatomic issue, you guys. The male urethra is longer, and it has to, let me see if I can turn on the laser pointer here. So here's our bladder in this male dog. Here's a bunch of stones in the bladder. If we trace where that urethra has to go, it's got to go up over and around the brim of the pelvis, creeps down, and then it's got to go underneath the os penis here. And so this guy also has a couple uroliths lodged underneath that os penis, and that's a super common place for them to develop obstruction, male dogs that is. It's also pretty common to right around the bend here have male dogs become obstructed right around that bend where those stones have to turn the corner. So when you have the presence of an obstruction, this can become absolutely an emergency presentation, and urinary catheter and retropulsion, or pushing that stone back into the bladder, is typically required, usually followed up by surgical removal. And just quick tip, my best recommendation is always going to be that if you have an obstructed male dog, they really do need to be under general anesthesia for them to be relaxed enough for you to be able to successfully retropulse that stone back up into the bladder. All right, different types of uroliths. Struvate are most common by far, but you can also have calcium oxalate, cysteine, urate, and silicate uroliths. Diagnosis, x-rays are big, ultrasound can be helpful. Urinalysis isn't necessarily going to tell us the stones, but sometimes the presence of crystals in urine sediment may warrant taking some x-rays of these guys and checking for the presence of actual stones. How do we treat these? Well, surgery sometimes does become necessary, particularly when we have very large stones or those stones are obstructed. Lithotripsy, that is something that they do in UNI, where they go in and they basically take a laser and pulsate and break up that stone through the skin with a laser. Diet, we do know, plays a big role with some types of stones. So particularly struvite stones can dissolve with medical management. So we treat underlying factors like urinary tract infection, as well as put them on something like a CD, or back in years ago, we used to have something called SD diet that we gave before CD to help dissolve those stones. But the recurrence rate with urolithiasis is extremely high, and that is something to keep in mind as you kind of talk to clients moving forward. Struvite crystals, here's the most common ones. You guys are probably familiar with these. They look like the classic coffin lid appearance. They are big. Technically, struvite is magnesium ammonium phosphate crystals. You can usually see them on low power magnification. They are by far and away the most common type that we see in dogs and cats, and they're often present in animals that are not showing symptoms of clinical urinary tract disease. They can be found in any urine pH. but their formation is favored in alkaline pH. So if you've got struvite crystals, there's a really good chance that that alkaline pH, that urine pH, is greater than 7. Now, a lot of our bacterial infections will also raise that urinary pH because they are urease positive. And so they raise that urine pH and increase the ammonia level in the urine, which precipitates crystal formation. So struvite crystals, however, those are good ones because those tend to be pretty responsive to dietary management. All right, bilirubin crystals. So these are a lot smaller than our struvite crystals are. Now, if we're seeing bilirubin in the urine, we are looking at conjugated bilirubin. So bilirubin that has already been processed through the liver, excreted through the bile into the intestine where it is absorbed, and some of it goes back into the bloodstream where it's processed in the kidneys. Some of it is excreted in the fecal material and broken down further into stercobilin. But bilirubin crystals are much, much smaller than our struvite crystals. They kind of come in two forms, and this picture represents both of those. So you can have these kind of little granular looking bilirubin crystals in the background, or you can have these more like needle-like spindles that are in there. They are yellow to brown in color, which makes sense. We know that animals with liver dysfunction turn jaundiced in some circumstances. They are very common and they are considered a normal finding in canine concentrated urine. So those two factors have to be in place. You got to be a dog and that urine's got to be concentrated for them to be considered a normal finding. If we don't have a dog or we have very dilute urine, then the finding of bilirubin crystals in urine should trigger your veterinarian to recommend further workup for possible underlying liver disease, in particular cholestasis. But these are very small compared to struvite crystals. Now, calcium carbonate. These species in which you will generally see these are horses, those of you that end up doing any equine work. So it's very common to find these calcium carbonate crystals in horse urine. They often kind of have this circular appearance with these little radial striations, or they may have this little hourglass appearance. Let me see if my pointer, I don't know if you can see my cursor on there, this little hourglass appearance here, or these radial striations that are moving outward. There are lots and lots of different sizes, and they tend to be yellow brown to colorless, but we do not see these crystals in dogs and cats, guys. But horses are the big breed, but apparently they also happen in rabbits, guinea pigs, and goats. Calcium oxalate crystals. Now, calcium oxalate crystals are colorless. They tend to either look like an envelope or they have this kind of X appearance. Here's a good one right here that has an X across it. These form in any pH and they can be any size, and they are due to abnormal calcium excretion, or sometimes they can be due to hyperparathyroidism. Miniature schnauzers as a breed here, mini schnauzers are predisposed to this particular type of urinary crystal and subsequently that type of urinary stone. Calcium oxalate stones can be challenging to manage. Diet does go a long way, but a lot of these guys that get calcium oxalate stones do tend to have recurrence. My parents had a little half calf, half cocker who had to have surgery twice over the course of his lifetime because of the presence of calcium oxalate stones. Now, pay close attention. I'm going to flip right back real quickly. Well, it won't let me flip back. Calcium oxalate monohydrate. So those are the dihydrate ones. So the ones with the X in the middle are the dihydrate. Now this type here, up here, these are calcium oxalate monohydrate. And the thing to know of importance about calcium oxalate monohydrate is that these are not good. This is called a classic picket fence shape, and sometimes you'll see them in clusters like you do down here. But these guys are pathognomonic for ethylene glycol or antifreeze toxicity. Now, there are a couple other causes of hypercalcemia that can cause these types of crystals, but every time in my career that I have seen ethylene glycol toxicity, these crystals are present. And so let's say you happen to be working in a primary care setting and you guys don't carry the antifreeze test in-house. which is common because they expire and they're expensive. One thing you can do if you have any suspicion of ethylene glycol toxicity is check a urine sediment and see if you can see them. A lot of times you will, but a lot of times also all these crystals with ethylene glycol toxicity, you can imagine it at the level of the kidney, these crystals essentially plug up the renal tubules, and what you end up with is what is called oliguric or anuric renal failure. And that means we have lack of urine production, either zero or greatly decreased. So if you are suspicious of an antifreeze toxicity and you can't find a bladder on an ultrasound, and that's common because their kidneys have shut down, you oftentimes will end up having to pass a urinary catheter to get just the teeniest. And when I say the teeniest amount, you might get less than a mil. You may get just enough to put that drop of urine on a microscope slide and evaluate for these crystals. All right, ammonium biurate. Ammonium biurate. So these crystals are called thorn apple in appearance. So they're round and they have these little prickly spikes that come off of them. They look kind of similar to calcium carbonate, but the calcium carbonates don't have these little spikes there. But we almost always see these in dogs and cats only. So if you are looking at a dog or a cat and you are seeing these types of crystals in the urine, that should lead you to one big clinical condition that you need to rule out, and that is disease of the liver, and in particular, portosystemic shunts. So that is where the blood is being either shunted around or through the liver without being processed. So sometimes we will also see these in Dalmatians, again, because they are urates, and Dalmatians are deficient in the uric acid processing pathway. You can also see them in English Bulldogs and apparently Black Russian Terriers. I don't know if I've ever seen a Black Russian Terrier. All right, cystine crystals. Cystine crystals are a little bit different. So they are flat like this, and they are hexagonal in shape, and you may see them in aggregate. So this is kind of an aggregate cystine crystal. This crystal, note here, you will only see this crystal in male dogs. So this is a male exclusive crystal, and we do think that there is a sex-linked inheritance. Therefore, because there is an influence, I'm just drawing with my highlighter all over it. There's this sex-linked influence with these crystals. If you find these types of crystals or stones obstructing dogs, and they're male dogs because these only happen in males, those dogs should be neutered to help prevent recurrence. I can tell you clinically, the times that I have seen these crystals have been in bulldogs, intact male bulldogs. All right, some other randoms. I'm going to take my face off here. Some random things that you will see. Up here is super common. This is what is classified by your SediVue or in your books or in your hospitals as amorphous crystals. So amorphous crystals can be made up of anything, and they can be present in healthy animals, and they sometimes will look like bacterial cocci. With amorphous crystals like this, if the pH of the urine is greater than 7, these are likely amorphous phosphates. If the pH of the urine is less than 7, they are likely amorphous urate crystals. And then down here, this is an image of tyrosine crystals, and I really only put them in there for thoroughness sake. I don't see a whole lot of those, but they are kind of slightly needle-like and not to be confused with bilirubin crystals. All right. What good image or what good discussion on urinary crystals probably shouldn't include lower urinary tract disease in cats? And so I initially started out to just give you guys a quick review of crystals, but I was like, you know what? You didn't have a companion with me. I know you guys are all familiar with this, but I'm going to give you my rundown on FLUTD in cats because I hate this disease. It's a tricky disease. It's a frustrating disease. Cat FLUTD or lower urinary tract disease is a huge problem, and it is one that I feel like we haven't made a lot of progress in the 25 years since I've been out of vet school. This picture I show you just because it is a picture of an actual intact male cat penis, and you can see the little barbs on it. And what I always tell staff and that I work with is that if you can see the male cat's penis, you've got a problem right there. Now, I will tell you that I do believe strongly that feline lower urinary tract disease is often overdiagnosed, quote unquote, as UTI. UTI is actually not very common in young cats. So when we have a cat that's 2 or 3 years old that's presenting with some hematuria or some stranguria that isn't blocked, that cat probably does not truly have a UTI. It is probably experiencing an issue with lower urinary tract disease, which is kind of this amorphous diagnosis that we use in our profession. Now, how do we treat these if they're not blocked? A lot of times we put them on pain meds. Sometimes we throw antibiotics at them, whether we think there's a UTI or not, because this disease has a very waxing and waning course of it. And for the most part, as long as they don't block, a lot of these guys get better. So it tends to look like our treatment has actually done something when many times it doesn't. All right, urethral obstruction in cats. This is the life-threatening part of the show, and you will see this all day, every day, whether you're in general practice or emergency. Keep in mind the anatomy of the male cat penis. It is short, it is delicate, and that urethra is super tiny. With crystal formation in cats, you're trying to pee all these needle-like crystals out this teeny tiny tube. And this bladder and this teeny tiny tube are lined with epithelial cells and mucus-producing cells. And so you end up with all this inflammation in the lower urinary tract, and the inflammatory mediators, so the white blood cells, the proteins, the mucus, combine those with crystals, and you can see how easy it can be for a male cat's urethra to become obstructed in these sorts of situations. So that plug is what results in a lower urinary tract obstruction, or quote unquote a blocked cat. So urine is our major excretory pathway of the body. And when they can't pee, you get kind of this constellation of things that happen. Number one, they hurt. And number two, all of the toxins, metabolites, and electrolytes that are normally excreted through urine by the body through the lower urinary tract then get resorbed into the bloodstream. So the BUN goes up, the creatinine goes up, the phosphorus goes up, and super importantly here, ding, 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 potassium goes up. So our normal range is like around 3.5 to 5.5. Well, when that potassium jumps up above 7, the heart and the muscle don't function well, guys. That potassium is so important for conduction. So let's talk a little bit about potassium excess. Changes in cell membrane excitability with muscle weakness and cardiac electrical conduction abnormalities happen when you get hyperkalemia. So in normal potassium levels, we have a normal looking ECG tracing. As the potassium increases, as we kind of go along here, you first get an elevation in or a narrowing of your T wave, which is an elevation of the T wave, and you get a shortening of your QT interval. Then moderate hyperkalemia will prolong your PR interval. Then ultimately the QRS duration increases, and then you end up with this terrible bradycardia. All the while, the heart rate is slowing down. So these really severe blocked cats with potassium greater than 10, they may come in cold as a cucumber and bradycardic as a calm athletic dog. So heart rate of 80, temperature of 96 degrees. So the only good thing about block cats, in my view, is that it's usually a pretty easy diagnosis as long as they're not super huge and fat. And if they are super huge and fat, then we can use our ultrasound to take a peek at that bladder. A lot of times clients will present these cats thinking that they're constipated because they are walking funny, or they're straining in the litter box, or they're acting painful. One thing clinically that I have seen tons and tons and tons of is when you ask clients questions about the last couple 12 to 24 hours, they do report that these guys vomit. So, and I genuinely think that vomiting is a combination of pain as well as resorption of all those toxic metabolites the urine usually kicks out. So imaging, of course, is super important to assess for the presence of stones. And the severity of this condition is also very much a spectrum. So they can be straining and just peeing small amounts but have an empty bladder, to a cold, obtunded cat. And I harked into my first year class that there is absolutely nothing good about a hypothermic cat. So cold cat is a dead cat. How do we treat these guys? So IV access is super important. We need to get them warm and we need to get fluids going in these guys immediately. So in terms of treatment of this hyperkalemic cat, it is really, really, really important that we stabilize these guys prior to sedating them to unblock them, because this is a case where we can kill these guys with anesthesia. So the things that we use to treat hyperkalemia, the insulin is a biggie. Insulin, it will push potassium pretty rapidly into cells. Now, of course, if we're giving insulin to a cat that isn't actually blocked, then we're going to also plummet their blood glucose. So we pair insulin with dextrose so that we can not plummet their insulin, and we get short-term relief of that hyperkalemia to get them as stable as possible until we can actually fix the problem, which is relieving the obstruction. Terbutaline, we give terbutaline IV. Now, terbutaline is a very potent bronchodilator, guys, but it will also very quickly push potassium into cells and so lower that level of blood circulating hyperkalemia very, very quickly. And then calcium gluconate. Now, calcium gluconate doesn't do anything directly for that potassium, but that calcium is important in muscle contraction. And when we give calcium gluconate slow IV over 15 minutes with ECG monitoring, that calcium gluconate does serve to be cardioprotective. So it is also super important to give these guys pain meds, things like buprenorphine or butorphanol, nausea meds. Serenia is great for everything. I think you guys know that at this point. And then we need to get them unblocked fairly promptly, but we don't want to kill our cat when we're unblocking them. So unblocking cats, you guys have probably all participated in or seen or dealt with a blocked cat. It sometimes is super easy. It sometimes is not super easy. And it's very, very easy to tear the urethra. So a lot of care must be taken to unblock these guys very, very gently. Now, therapy long-term, diet. This is where diet plays a role because this condition is so frustrating. While they're in hospital, we continue giving them IV fluids until we get them diuresed or we get that potassium corrected, but that usually corrects in like 4 to 8 hours. B, get that BUN and creatinine normalized, and C, get that bladder essentially kind of flushed out. So we like for there to not be massive hematuria. We like for there not to be visible crystals in that closed collection set because you'll see those guys all the time. Long term, this is a soapbox for me. These guys need to eat this stuff for life if they have one episode of blocking them. And I try to put the fear of a giant vet bill and a cat's death into clients when we are discharging these guys from home about how important it is for them to continue to eat this diet and not decide 6 months, a year, 2 years from now that they're doing pretty good and this food's really expensive and to take them off of it, because that is very commonly within a couple weeks to months is when you'll see them back in your clinic blocked again. So I do believe that diet plays a big role. These guys should be treated with pain meds, y'all. This is a painful condition. So once that BUN and creatinine is normalized, totally okay for something like Enantior to be put on board. Laser therapy of the bladder, laser therapy of the urethra can also be helpful. Antibiotics is a question mark, and that's a soapbox issue for another day for me. I usually do put them on antibiotics, but I personally usually wait until the urinary catheter is removed before I start antibiotics, because putting antibiotics on board in the face of an indwelling urinary catheter increases the risk for developing bacterial resistance to antibiotics. And so unless there is very clear evidence that there is UTI at the time that we unblock them, remember most of them are not UTI, most of them are this lower urinary tract inflammatory and crystal mediated disease. Urethral antispasmodics, let me see if I can get my face off of here. Urethral antispasmodics can be super helpful. And behavioral medications. Amitriptyline is getting a resurgence in treating these guys, as is acepromazine. Both of those drugs do have some antispasmodic action in the urethral smooth muscle. And then stress, environmental modifications. So making sure there's enough litter boxes, maybe reassessing the intracat dynamics in the household too. But this is a real frustrating condition because it recurs a lot. And this image here is a guy that has had a PU surgery, or sort of perineal urethrostomy, which is kind of a salvage procedure, meaning they've blocked a couple times. And now we are essentially doing a partial penile amputation and, pardon me, a urethral splatulation. So you make that urethra shorter and wider, open that urethra up a little bit. And this is about a day 7 post-op PU, and this actually looks pretty good. This is a little bit of necrotic tissue that's going to fall off, but under here, there's a pretty healthy looking granulation bed in this situation. But unfortunately, even in the face of a PU, sometimes these guys can block. But I managed to wrap that up in under 29 minutes. I had aimed for goal of 20 minutes, so I'm sorry for that, and we will see if this all comes to fruition. Thanks, guys.